Today we are learning more about sarcoma, a cancer that begins in the bones and soft tissue like fat or muscle. Dr. Michael Egger is an expert in this field. So let's start with the cancer. We know it's uncommon. It has different forms. What else can you tell us about it?
So sarcomas are made or arise from the connective tissues of the body, the things that keep us together, basically. Unlike something like lung cancer or liver cancer that comes from the organs, it's things like the fat tissue, connective tissue, muscle, things like that. And it's from those different tissues that these sarcomas can arise, and they can come, basically anywhere across the body.
And we were talking just in the break here about just how rare this is. This isn't something you're seeing every single day.
No, the American Cancer Society estimates somewhere around 13,000 or 14,000 new cases are diagnosed in the U.S. every year.
Wow. Okay, so what are some of the signs and symptoms a person at home might start to notice?
Usually these present as like a mass. You'll feel a swelling, a lump, or something like that. Now, we all have sort of lumps and bumps that we develop over time, but sarcomas will typically grow more rapidly. They'll be more firm and potentially painful depending on where they're located.
And we know with the Brown Cancer Center right here in Louisville, we really have this excellent resource. What does treatment look like if someone does come and get referred to you guys and you give this diagnosis?
So it's a team sport, which is one of the reasons I like taking care of these cancers. So it's a multidisciplinary approach. So surgery is typically the backbone if we catch it early, where we can resect the tumor, and then we consider something like radiation therapy to reduce the risk of it recurring. And for some sarcomas, we consider chemotherapy as well. After that, there's a lot of rehabilitation involved because, again, sometimes we're removing muscle or nerves, and so our rehab specialists are really important to the recovery of the patient as well.
And we know outcomes can vary so much patient to patient, but is this one that you usually can say, yes, we can treat, we can work through?
We hope to. If we find it early enough, our goal always with sarcomas are to remove them completely and not have them come back. Certainly the more aggressive kinds, we worry about recurrence, and we are undergoing clinical trials and experimental treatments as well to try to treat those more aggressive, more rare tumors.
Well, you guys are doing great work over there. We really appreciate it. One final word here. We always like just to give people anything that they can do just to promote a healthy lifestyle and possibly avoid something like this.
All the things, there's not a lot of known risk factors for sarcoma. It's all the things you've been told your whole life. Eat well, exercise, get enough sleep. Nothing is specific for sarcomas.
Okay, so just be healthy.
Yes, right.
Okay, very good. Dr. Egger, thank you so much for coming on today. We really appreciate it.
You're welcome.